Now, hypertension is a silent killer because one can even be unaware that he or she is hypertensive because the symptoms are usually not noticed. It goes silently. This is Nurse Victoria. Welcome to another interesting episode of Health Education series. Today we'll be talking about raised blood pressure or hypertension. As the heart beats, blood flows through the blood vessels. The pressure with which this blood flows through the artery is what is called blood pressure. High blood pressure or hypertension is a medical condition characterized by sustained elevation of blood pressure above 140/90 millimeter mercury, and becomes severe when it is noted to be above 180/120 millimeters of mercury. Blood pressure is measured with two numbers. One is the systolic blood pressure that is noted when the heart contracts, and the other is the diastolic blood pressure, which is noted when the heart relaxes. Hypertension is diagnosed when the blood pressure is monitored on two separate occasions and noted to be sustainably high above 140/90 millimeter mercury. About 1.28 billion people have high blood pressure. WHO, which is World Health Organization, has estimated that over 1.5 million people per year have hypertension in Nigeria. Now, hypertension is a silent killer because one can even be unaware that he or she is hypertensive because the symptoms are usually not noticed. It goes silently. The causes of hypertension is not known, though it's traceable to age as one advances in age, family history for those that already have parents or grandparents that were hypertensive, lifestyle, that sedentary lifestyle, those that are inactive, obesity, unhealthy diet, like consumption of alcohol, tobacco, smoking, consumption of so much salt, eating unsaturated fat like red meat. Most of these things contain cholesterol, which eventually deposit in the lines of the blood vessels, which make them clogged up, and the pressure with which blood that flow through these arteries become increased. That's when one breaks down with hypertension. Like I earlier said, the symptoms of hypertension are sometimes unnoticed. However, it could present with symptoms of headache most times in the morning, dizziness, tiredness. You could have blurred vision, heart palpitation, that's awareness of your heartbeat, nosebleed, as you can see drops of blood from your nose. Hypertension could be managed with reduction of stress, exercise, healthy diet, as reduction in consumption of red meat, unsaturated fats, reduction in consumption of alcohol, cessation of smoking, drinking a lot of water, and being active, because having a sedentary lifestyle increases your chances of being obese. Then medications, there are different drugs for treatment of hypertension. The doctor prescribes the drug based on the age of the patient or what could have caused the hypertension. There could be ACE inhibitors, there could be diuretics, there could be calcium channel blockers, there could be beta blockers. Either of these drugs can be prescribed for you to help reduce the blood pressure. Now, the complications of hypertension are usually severe, that it could be life-threatening. Heart attack, because like I said earlier about cholesterol clogging the blood vessels. If there's a reduction in the flow of blood to the heart, there could be reduced oxygen supply to the heart, and then one could break down with heart attack. Stroke, if the pressure in the very tiny blood vessels of the brain increases and these blood vessels rupture. If it happens on the right side of the brain, then the left part of the body will be affected. If it happens on the left side of the brain, then the patient could be paralyzed on the right side. Now, hypertension is a condition that should be taken quite seriously because of its peculiarity. So it's advisable that you take regular clinic checkup seriously. Ensure you monitor your blood pressure. As one is advancing in age, the risk of development of hypertension is there. So regular clinic visits and monitoring of blood pressure is very, very advisable. And then for those that are already hypertensive, that are already been diagnosed, stick to your medical regimen, eat healthy, adhere to your medical advice. I'm sure you enjoyed this session of our health education series. Do well to share this video with your friends and family, and don't forget to click on the subscribe button. This is really important. Please click on the subscribe button and drop your comments in the comment section on videos you'd like me to shoot or comments regarding this particular video, and I'll see you in the next episode of another interesting session. Bye for now.
This city never sleeps.